Clean water and sanitation are basic human rights. There's international consensus in this through the Sustainable Development Goal number 6, which is devoted entirely to water, sanitation and hygiene programming. We also know that there's a lot of push from the ground up for WASH programming. For example, rural communities typically rank WASH programming very highly in their needs assessments. And finally, of course, there's big programs being implemented to improve water, sanitation and hygiene access, both by national governments and also by the development partners. There are literally hundreds of studies looking at the impacts of WASH programs. 3IE conducted an evidence gap map which collected this evidence into a user-friendly format, and it's available on our website. This showed that whilst there's a lot of evidence around the health impacts of WASH programs, much of that evidence isn't collected very rigorously. But secondly, and importantly, very limited evidence on the empowerment aspects of programming, such as drudgery or safety for women and girls that either have to walk long distances to collect water or defecate in unsafe places. And also, there's very limited evidence on the specific programs which are used to promote behaviour change. 3IE has major partnerships with some of the world's biggest funds in conducting rigorous evidence. In a partnership we have with the Water Supply and Sanitation Collaborative Council, we've produced 2 systematic reviews which are on the incorporation of the life cycle approach into WASH programming during the MDGs period, and that study's now available by Tilai Rajan and authors. And a second study by Emmy de Buck, which looks at specific behaviour change programmes in sanitation and hygiene. The review was conducted in 2 parts. The first part looks at the impacts of these programmes. That evidence indicates community involvement is an important component for programmes to improve behaviour change. Approaches like community-led total sanitation, for example, work to improve latrine uptake and to reduce open defecation rates, while social marketing approaches are particularly useful in improving hand washing behaviours. But the review also found that simple hygiene messaging doesn't work. The review team also collaborated with an international stakeholder engagement group comprising policymakers and practitioners, and that group indicated that the second part of the review, which was on the barriers and enablers of effectiveness, would be particularly helpful in informing programme design. 3IE has produced a user-friendly summary report and a policy brief, which are both available on 3IE's website at www.3ieimpact.org.